how flexible are you with the plan? Maybe you could touch on some of those things.
Absolutely. You know, the big part about it is when we take the time to talk with people every step of the way is to make sure we understand that from a pain condition, we're usually looking at it from two big categories. Is this an acute, recent injury type of situation, or is this something chronic? Have you been dealing with this for more than 3 to 6 months, and is it flaring up more than 3 times in a week? You know, is it chronic? How long have you had it? Tell me about what happened. Let's sit down and talk. Heaven forbid that you sit down and talk and get some good response on what led to this. Tell me about every little thing, and I'll ask questions like, you know, was it a car accident? Did you fall on the ice ever? And I mean ever. And so all these types of things, even as minute as they might be, or no, this was a shoulder surgery that I had. Like, oh, okay, then we know how to start delving into it right away a little bit quicker. But we also want to understand the complications so that when we really go into it as far as a care plan goes, something acute that we can get on right away, boy, we can really see some incredible improvements in just treating somebody 3 times in a row. And by in a row, I mean let's have 48 hours in between each one. So like a Monday, Wednesday, Friday kind of thing. And at the end of that 3rd treatment, I'll have someone come in for a 4th follow-up and like going, how are you doing? Where are we at? Are you pretty much at a point where we need 1, maybe 2 more treatments, but with an acute situation, we're probably seeing exactly what we have left to do to get you back as our goal, 90 to 95% back to normal. That's our goal. You know, let's work together to get you there. Now with chronic, what severity of chronic it is, where it is in the body, is it muscle tension, scar tissue, both? Is it other injuries that have led to that and now you're compensating and that's adding to it? All these things that we're going to take the time to really discuss and diagnose. So we jump into a care plan for chronic. We're usually seeing those anywhere from like 6 to 8 treatments in the world of chronic care plans. And we're going to see each other probably like once a week versus with an acute. It would be beneficial to see it like Monday, Wednesday, Friday and see where we're at. And with chronic though, it's kind of already there. So we just need to start peeling away the conditions as we go after primary and secondary, or as secondaries show up, now we'll focus on them as well because the body's going to start responding and showing us what's left. And we're going to be able to really dig in and roll up our sleeves, if you will, to go after that chronic care plan as uniquely as it needs to be done based on the individual and that individual's body and that individual's injury as we go through that type of chronic care plan approach of, say, 6 to 8 treatments. Adjustable, obviously, based on how well your body responds. Because you were bringing up a good point as far as what to be expected as far as going into the care plan. The timing is usually like that for the acute versus the chronic, and how we're going to see each other and how often. But what's more important with that is that as we go into these type of treatment plans, not only is it adjustable, but once we get to that end point and we see that you're going to start feeling better, we know that some of these things might still result in maintenance afterwards. So we always like to keep people open to the idea that, you know, once we get things better and we've communicated along that pathway, what might be left, we might have to see you once a month if you're going to continue being an aggressive runner. And you have a partially ruptured Achilles tendon and we need to keep that in shape because you're probably not going to stop running. And we're going to do our best to help keep it from ever becoming chronic again. So those kind of situations. Or maybe it's once every 3 months because, you know, we've gotten your knee and your shoulder as good as it's going to be, and there's a great deal of relief, but as our seasons change and barometric pressure kind of sets into our joints, well, then we want to be able to, well, come on in, not just because the weather changes, but if you start to see it flaring up and your body is not recovering like it should, we want to get in there and make sure that it does recover. So that might be like, say, once every 3 months. Some people we might see only once every year at that point. Or, of course, if someone has an injury and it flares up instantly, yes, come see us as fast as possible, once again, to nip it in the bud and not let it become chronic.
So you bring up some really good points, and what I think I want to hit on here is oftentimes in the way the healthcare system is set up right now, you know, people will go to a healthcare provider expecting something to be done on them or to them, and there'll be resolution. And it almost puts the responsibility on the healthcare provider, and the person doesn't embrace or own the experience. So how do you draw somebody into their own care so that, let's say they get through, whether it be an acute or a chronic situation, they've come through it, they recognize the benefit, and they want to keep being well. You know, what is your experience, or how do you try to communicate so that they start to understand that it can't be same old anymore, you know, with regards to what I think or see myself from a health perspective? How do I move forward so that I'm caring for myself?
You know, the point that is very revealing to people is that when we talk them through what they're going to see happen, and then when it happens, they start to understand that change does have to also occur in their life, not just in what we're providing. A lot of people have gotten used to it being a one-stop shop, a very quick fix. Pills, pokes, surgeries, we don't do any of that. We're actually working with the results of a lot of that. How to get people off pain meds.
Right.
But so all part of that revealing as we go through the care plan is part of what we touch upon to reinforce on them, like, okay, let's talk about that. Let's talk about what's changed now for you and how it's going to be able to be maintained by yourself. We talk about nutrition a lot, just to make sure people have a good grip on that. We offer up very good guidelines right off the bat that people take home with them, so they can see what we're talking about, and in a very positive, cheerleading, broken record, reinforcing that as we go through the entire care plan to make sure people are on board with that. We all try to do a good job of eating, but from a nutritional standpoint, you know, you got to take a look at what maybe your body is asking for more of while you're in repair mode. And if you're not giving it to it, it's never really fully engaging its recovery process. We're turning that recovery process on into full power mode. But it still needs the body to supply what it needs to get through that. So based on what you're asking for that too, we want to give people guidelines that we strongly recommend for pain care plans. Talking about things like supplementation on a daily basis that includes key elements like magnesium, B6, D3 at the levels that are not only medically recommended, but double checking with some of my pharmacy friends to make sure, like, going, no, that's right on course, to make sure that we're giving people the best advice possible. And once again, they're only recommendations, but boy, we see better results with than without. So
you really have to engage in your own health and recovery, like you said. So other things that you've talked about at length is being a mover, so engaging in some sort of yoga practice and being mindful and having some sort of meditation practice as well. So can maybe you touch on some of those things as well?
Yeah.